Public Safety Answering Point Managers Group. MAG staff will now take roll to ensure we have a quorum present for the meeting.
Thank you, Chair. I'm going to go through the list. Please make sure you're unmuted and indicate if you are present when I call your name. Apache Junction, Lisa Amheiser. Thanks, Lisa. Trish Price, ASU.
I'm here.
Welcome, Trish. Mike, Lydia from Avondale for Mike Foley.
Present.
Okay, thanks, Lydia. Jim Totora, Buckeye. Okay, Stephanie Heinzelman, Chandler.
Present.
Hi, Stephanie. And was it Karen Nielsen with DPS?
Yep, Kira Nielsen.
Okay, and Lynn has retired.
Yes.
All right. Sergeant Beebe with Fort McDowell. Kim Weber, Gilbert PD.
Present.
Thanks, Kim. Loretta Hadlock, Glendale PD.
Present.
Shauna Henry, Goodyear PD.
Present.
David Demers, Luke Air Force Base.
Present.
Jim Stillwell, MCSO.
Present. Good morning.
Good morning. Nicole York, Mesa Fire.
Present.
And Matthew Almner with Mesa.
Present.
Heather Beckwith, Paradise Valley.
Present.
Brittany Brunet, Peoria.
Present.
Nicole Dietrich, Phoenix Fire.
Present.
Hi, Nicole. Dan McNamee, Phoenix PD.
Present.
Ian Walter with AMR Rural. David Martin with Salt River.
Good morning, present.
Good morning, David. Karen Sutherland, Scottsdale.
Good morning, present.
Good morning. Damala Finney, Surprise. You hear Damala? Tanya Logan, Tempe.
Good morning, present.
Good morning. And Tolleson PD.
I am here. It's Karina Bandine.
All right. Welcome, Karina.
Thank you.
Lieutenant Hadley, Wickenburg.
Good morning, Aaron Hadley's present.
Thank you, Lieutenant. Chairman Brunet, we have a full quorum. Oh, you're muted.
That would help. A quorum is now present. I would like to welcome Lisa from AJPD as our newest PSAP manager. And the meeting of the MAG Public Safety Answering Point Managers Group is now called to order. We'll go ahead and move to agenda item number 2, call to the audience. Members of the public were asked to submit written comments related to this meeting through the MAG website. Comments may be sent at any time leading up to the meeting, but must be received at least 1 hour prior to the posted start time for the meeting. This is the opportunity for the public to comment on items that fall under MAG's jurisdiction that are not on the agenda or that are on the agenda for discussion and not for action. MAG staff, have we received any public comments? If so, please read them at this time.
Chairman Brunet, we've received no comments for this item or any other item.
I copy no comments, and we'll go ahead and move to item number 3. Our next item is approval of the April 14th, 2022 meeting minutes. Does any member of the PSAP managers group have questions or comments on the meeting minutes?
Brittany, this is Karen from Scottsdale. I do have one comment.
Okay.
On page 16, where it's discussing overtime, I think that this sentence might be written a little bit awkwardly. It's toward the beginning about, let me see, 1, 2, 3, 4, 5, 6, 7, 8 lines in. I think it starts 6 lines in. It says the first option is to have 911 overtime costs covered by MAG member agencies, which means each PSAP would go into an agreement with that they would cover their PSAP overtime. I don't think that the question was covering their PSAP overtime, so I thought that maybe it needed to be changed to MR 911 overtime for work at their PSAP.
Chairman Brunei, that would be correct. We can make that correction. So if we can just add that to the motion, accepting that change.
Okay, do I have a motion to make that change?
Well, you'll make it as, I believe you'll make it as part of the minutes.
Okay.
Chairman, with that change, I will motion that we accept the minutes for approval. Karen.
Okay, so we have a motion from Karen from Scottsdale. Do I have a second?
Loretta Hadlock from Glendale PD.
And Loretta for second. Is there any further discussion of the motion? Okay, Mags, there are no further discussion. MAG staff, would you please take a roll call vote?
Taking a vote, we'll start with AJPD, Lisa.
Sorry, I'm having technical difficulties. I vote yes.
Yes. Lydia with Avondale,
Yes.
Jim with Buckeye, Stephanie Chandler PD,
Yes.
Sergeant BB Fort McDowell, Kim Weber Gilbert, Kim Weber Gilbert.
And then
Aye.
I'm sorry, say that again.
Yes.
Loretta Glendale,
Yes.
Shawnee Henry Goodyear,
Yes.
Jim Stillwell MCSO,
Aye.
Matthew Mesa PD,
Yes.
Heather Paradise Valley,
yes.
Brittany Peoria,
Yes.
Dan Phoenix PD,
Yes.
David Salt River,
Aye.
Karen Sutherland Scottsdale,
Aye.
Damala Finnessy with Surprise, Tanya Logan with Tempe,
Yes.
Karina with Tolleson,
Yes.
and Lieutenant Hadley with Wickenburg.
Yes.
Is there anyone I didn't call? Chairman Brunei, the motion has passed.
Okay, we'll go ahead and move to agenda item number 4. The next item will be the administrator report. Liz Graber, our 911 administrator, will provide this report.
Okay, thank you. And if we can go to the next slide. There we go. We get a drink first. Since we've had 64 year to date, well, actually, ending in May is when the report runs. And that is on trend as a little high. So it could be a record-breaking year, but we're at 64. Text to 911, we're at 4,777 as the end of May, and that is also trending high. So that nothing surprises on there. If those that weren't able to monitor, the FCC had a 988 presentation talking about behavioral health, mental health, suicide hotline, and how that will work, and how can it work similar to 911. We had this question a ways back, for if any of you can remember, with 211 is how can you provide the ability to route a call appropriately to the right agency. You can do what they call an N11, meaning any number with a 3-digit number at 11. But it has to, but 911 is unique that we route it to the area that you are calling from. So it's not just a generic one call answer. So 988, the FCC and their stakeholders were discussing how important it was to get that, to have the ability to have it go to the right community for help. And what that looks like. There'll be many more discussions. It's very interesting. I'll be curious to see if any of the 911 systems in throughout the states or any of the 911 systems in the US decide to incorporate their 998 with their PSAP. There's a lot of pluses and minuses with that, but that's a curiosity question to see if anyone will take that step to have them housed with them in the 911 building as well. There is I put the URL code on there for to take a look at it and to see what the discussions that they had at FCC. It really was interesting. And then ACC, the Arizona Corporation Commission, had a workshop group about 911 outages. Unfortunately, I was out of the country when that happened, but some of you attended, were invited. The state did a 911 presentation on the state of 911. That link is also there available for anyone that wants to take a look at what was presented. Karen, you had a question?
Yeah, it was back to the 988 presentation. I was wondering if there's anything, I know that they're going to be going on a soft launch within the next month or so. Is there anything that we need to be doing in our PSAPs or working with you so that we are able to transfer to 988? Because that's not exactly a star code and it's not a 10-digit number.
Yeah, so we will have to, even though it's 998, there is a 10-digit number that's associated, a routing number. That's how 911 works. And star codes is unique to Arizona. But as soon as we get something that we can be able to transfer, we absolutely will. I don't have that information of what that number will be or how that will work. But one of the discussions they did have is how can it transfer to us? Not only transferring to them, but transfer to us. And I would say, this is going to be an individual unless we want to do it as a region on what a policy are of when to transfer to 998. And including sending someone out that might have to be at a PSAP level, but we will coordinate getting everybody speed dials, as it were, for as soon as we get the information on how they are going to handle that transfer. Does that answer your question, Karen?
Yes, it does. Thank you.
Okay, and Jim?
Yes, I just wanted to mention again in regards to the 988. If there is anybody that's on the call today that that's interested in knowing more or would like to hear more about that program, they are a presenter at the APCO-NENA conference here in a couple of weeks, and they'll be giving an hour-long presentation on Thursday regarding the 988 program.
Oh, that's good. Perfect. And what a good plug for the APCO-NENA. So, so that would be, if anyone is attending that or would like to, the APCO-NENA website that Arizona has a registration, and it looked like it was pretty reasonable, and be able to attend that. Who's giving that presentation, Jim? Is it from somebody from FCC?
Yeah, it's CJ, I believe her last name is pronounced Loisel. She's with the Arizona Cost Containment Department, as well as I forget the other gentleman's name. He is with the vendor that the state has contracted with to provide mental health services.
Yeah. Okay. Very good. All right. Thank you. Any other questions or comments on my report? Okay, Chairman Brunei, I turn it back over to you.
Okay, this item is on the agenda for information only. Please contact Liz after the meeting if you have any questions regarding this report. We'll go ahead and move on to agenda number 5, which is the budget review. Liz Graver will provide this update.
So thank you to all the PSAPs that turned in their budgets. And as we had talked about in the past, one of the reasons we came up with having meetings every other month is to allow more meetings and more FaceTime, because we felt like quarterly wasn't enough. And one of the particular things was the ability to talk about a budget before we vote on it. And so the June meeting will be us getting our first glimpse at PSAP requests, and we compiled all the PSAP requests, and we're specifically looking at adding additional 911 workstations. So we will not be voting on any budget items. That is going to be in the August meeting. So this is just discussions that allows the PSAPs that are requesting additional positions to have a platform and us to ask them questions and just to get an idea of what their needs are. So if you can go to the next slide. Here is the 6-year forecast. And as you recall, we're only focusing on fiscal year 2024. That's where our justification's needing. Everything past that is going to be forecast only. So it was only documentation and justification were needed for fiscal year 2024. On just as a reference, our upgrades for that fiscal year will be ASU, Avondale, Gilbert, Peoria, and Wickenburg. Those are the ones scheduled for there. We've have, you can see in the red, moving and remodeling codes. So Buckeye is moving, Gilbert's remodeling, Glendale's remodeling, Goodyear's remodeling, Scottsdale's remodeling. So it's going to be between the upgrades and the remodels, it's going to be a busy year. If we can go to the next slide. So here's a breakdown of the workstations and what they are requesting. So Phoenix 10, Goodyear 5, Mesa Fire 3, Scottsdale PD 2, AJ 1, Chandler 1, and Wickenburg 1. And the state put out, and I saw they put out an email to all the PSAPs and also sent it to me on the latest and greatest call ratio, and they're going to talk about it later on. But I wanted to let you know that bar, what we talked about in our last meeting, it was at 3,095 was the average, and the average on this one has changed to 3,954. And just for giggles, I went through the last call ratio sheets that the states handed us, the original, the one back in April, and now this one. And it's been consistent on what PSAPs are eligible and what. The only one that was added in this latest run was Avondale. So the ones that meet the mark with MR 911, and this is regardless of whether they put in for positions or not, these are just who were eligible, was Phoenix Fire, Glendale PD, Phoenix PD, Maricopa County, Mesa Police Department, Mesa Fire Department, Apache Junction, Scottsdale, Tolleson, Chandler, Surprise, Tempe, and Avondale. So those ones that met the mark that the state has put forth on eligibility to fund additional workstations. So now what we're going to do is have each of the PSAPs listed there, take a turn, and we want to hear from those PSAPs what the justification of what they're wanting. Help us understand what your plans are, or what you're looking at, or what your needs are, and why you're adding those positions. And will you have the documentation to justify that? And the question, and we can do it after the presentations are done, the questions I think the PSAPs need to wonder is, right now the state has a funding, but do we want to put these numbers in the formula that our governance group came up with? And we haven't tested it out, but this might be a good one to have the governance group crunch the numbers and see how it compares to what our level would have been or would be, And then, because we know what the state's funding threshold is. So any questions before we turn it over to the PSAPs? Okay, so we'll just go in order there. So Phoenix PD, court. Did I have a note that court's going to be doing this? Dan, is court, are you going to be doing this presentation?
Yeah, court is going to do, we're just having some technical difficulties. Just 1 second. If
Yeah.
you want to move past us till we get it figured out.
Yeah, you got a big echo, so we will go past you. Good year, Shauna, go ahead.
Okay, I'm not really sure what information you're looking for, but I requested 5 positions due to the growth that we've experienced and the growth that we're anticipating. Our current staffing is for 20 FTEs. We're adding 8 FTEs in the next 2 years. I have 3 coming on this year, so the total will be 11. Currently, we are full most days of the week and don't have room to sit additional. I'm actually sitting trainees in the supervisor's office to complete training. I am not sure what else. Let's see. Goodyear, as you all are probably aware, is one of the fastest growing cities in the country. In 2020, our population was 94,774, and it's currently a little over 102,000, which is a growth rate of almost 7.5% annually. The population's increased 51% since 2010, and they're anticipating it will continue to grow exponentially. Besides population growth, we're also dealing with industrial growth, and they are estimating that we have, so we no longer are just a residential community, we're also a commuter community where people come here to go to work during the day, and they're estimating about 75 to 100,000 people come into our city each day to go to work. All of this is resulting in drastic increases in calls for service and in the calls that we're receiving. We're increasing our 911 calls about, well, in 2021, there was a 25% increase over 2020, which we all know the pandemic. So realistically, it was actually only about a 15% increase from 2019. And we're looking at an anticipated 38% increase in those calls this year. That's what it's trending at right now. We're also seeing a 40 to 40.
John, I think we lost you. You also see a 40 to 40, and that's where you cut off.
Oh, sorry, where was I at? About a 40 to 45% increase in calls for service each year. And also we're seeing drastic increases in our non-emergency. And of course, with all of the increase in officers and calls for service and activity, we're seeing increasing in all of the other things that we handle inside the PSAP, including, you know, the assiduous work and other things. But the biggest concern is the need to expand and have more positions for our call takers to sit at. We're expanding from our minimum staffing of 4, which generally we're at 6, to we want to expand it to 6. We're also adding a data channel, which will add 1 more full-time position that needs to be seated in the room. So the request is for 5, as that will help us to start to fill out our room and anticipate the growth that's coming. So I guess if anybody has questions, I will try to answer them.
I can say that, you know, 12, you said 12%, Shauna?
12% growth?
In call volume, 911.
Well, our 911 volume is up 25% from 20 to 21, but because of the pandemic, if I kind of adjust for the drop during the pandemic, it's probably closer to 15.
Okay,
but
and
we're
that's still
38%. Currently, we're at a 38% increase over last year.
And I can tell you that's a significant, 15% is a significant raise. That's more than we do as a region, what our growth is. So That is a significant rise in 911. And I do have to say, your documentation was the prettiest. It was all sorts of really good information. So thank you, Shauna. Phoenix, are you ready? All right. It sounds like they're still working on their audio. Nicole York with Mesa Fire, you're next.
All right, well, bear with me. I don't have a bunch of fancy numbers like Goodyear did, but I do have the state report. We're asking for 3 positions. You can see the average is 39.54, and we're right now at 52.88 for our call to seat ratio. And our call volume also has been going up. We are adding some CAD workstation terminals for expansion and growth with our staffing. So we would need the phone, obviously, to go with that. Also, we are currently doing the calls for Florence Fire, and their seat ratio is 26.50. We've only been doing it for just about 2.5 months, so I don't have a bunch of numbers to work on, but based on that, we're averaging about another 2,880 a year that would up our need for the consoles also. So I did talk with Travis over at the state, and they did say that based on our numbers, that should support the 3 seats based on the call volume. What else do you need from me?
You're muted.
Yep.
Yeah, here we go.
Got me. Is the Florence dispatching for Florence, is that a permanent like contract thing, or to help them until they decide what they're going to do about a PSAP?
So originally it was just helping them. They signed a agreement for 90 days. They have asked to extend it. They're wanting to extend it for a year with the plan of eventually going on with us. But right now it's kind of a political thing going on with their city managers and our city managers. But everything we're seeing does look like we probably will be getting them.
Do they still have law enforcement dispatch, or did that get sent to another agency?
PCSO is doing their law enforcement, and then there's some weirdness, like I guess they still have a couple Florence PD dispatchers, 2 of them, and they're like covering the weekends, but then PCSO does it during the week. I'm not exactly sure, but as far as the fire and medical calls, those are all coming to us. So the only thing is it's either transferred from one or the other agencies, but they're all coming to us.
And you met with the state on funding eligibility?
I just talked with, we had a little meeting with Travis Jensen over at the state, and he said based on the call volume that they would support the 3 additional seats.
Okay. Any questions for Nicole? Okay. Dan Court, are you ready?
Here to read that. Yeah, can you hear me?
You got a bad echo. All right.
Good morning. Can you see us?
Yep, there you go. You're good.
Now we can't hear you. Hold on one moment.
You have to push a button on this.
Probably can't.
All
Can you hear us?
Yeah, I can
No.
hear you, and I don't hear an echo.
There you go.
Okay.
Morning, everyone. My name is Court Hood. I'm one of the shift managers here at Phoenix Police, and someone very carefully blurred out the background because I wanted to take a moment to introduce you to the other managers in here. This is my second PSAP managers meeting, and for some of us in the room, it's also their first or second as well. We've got Mindy Briggs, who is our radio network manager in attendance. We obviously have Dan the Man here. We have Amy Kubisak, who is one of our shift managers, and we have Mila Maravich. So again, it's blurred, but we are all here, and so we thank you for having us. So regarding our request for the 10 additional positions beginning in that fiscal year 23-24, it really centers on increased complexity of our operations and an expansion of our hiring and the number of staff we have on hand at any given time. For those of you who may not know, we work currently out of 2 sites. we concurrently out of 2 sites. We work out of 100 East Elwood, and we work out of 620 West Washington. We are now in the planning stage of moving our operations from 620, which will be just decommissioned as a operational building, to a new facility at 100 West Washington. So it's not as nice or spiffy as what MCSO has, but we're going to do our best to kind of remodel that structure to be able to accommodate us. So really, this is the first request for additional positions that we've made since 2008, when we got to the number that we have now. And again, our request really centers around the increased complexity of our operations. Right now, those positions that we have, the allotted positions, are split between 100 East Elwood and 620, or what will be 100 West. And with either of them, neither of them provide us the capacity that we need to run as full operations as we have, should we need to fall back to one or the other. And again, this is a situation that might be unique to Phoenix Police alone, but redundancy is a huge issue and a huge challenge that we have to meet, and the increase in positions will allow us to meet that need should we need to have a fallback. I believe this year alone, we've had 3 or 4, everything from floods to AC outages to power outages, and even access to the building challenges with the light rail situation that's going down Central. So again, having the increase in positions allows us to more fully staff one facility, namely 100 West, should we have that fallback need, which again, we've used. The other one is, let's talk a little bit about our call volume. I know Goodyear, and I believe the other agency had mentioned upticks and anticipated growth in their calls for service. Ours, we in our justification memo, we had a slight uptick of 300,000 calls for service, or I'm sorry, 911 calls received, up from 2020. So slight uptick, but it's significant enough to help with this request. And per the state's requirements, we are double calls per seat than the average. We're roughly around 8, or I believe 8,000, I want to guess. And the average is sitting somewhere around 3,000 per seat. So regarding the numbers, that's where we fit in there. One of the other topics that kind of impacts our request is our training and hiring. Right now, we are sitting at a vacancy rate of about 32. That's a net gain of about gain in a good way, meaning it's come down from roughly about a year ago. We were at about 42 to 46 on average. And so we're making headway in our training program to bring on more staff. The city just provided retention bonuses, so we're hoping that has a positive impact on our attrition rate, and so we have less individuals leaving. And so as we're training more, again, we have a net gain that increases the number of staff we have on hand at any time. We currently have about 70 operators or new employees somewhere in our training program, either on the job training or waiting to finish their radio training. Again, it's a complexity issue, but again, that number is around 70, and we anticipate that may grow. And at certain parts of their training, we need additional space and capacity to be able to facilitate training. Perhaps you do it in some of your PSAPs, but in Phoenix, once we get to about the midway mark in our training program, we separate our trainer and our trainee. So you've got one training pair occupying 2 positions. So again, depending on the number we have at any given time, we need increased capacity as well. And once we complete, the goal is to close that vacancy gap to 0. And then as part of our strategic plan, we're asking for the additional 40 positions that we had in the early 2000s. So again, for us, it really is a capacity issue, not so much a call volume issue, but a capacity issue and a complexity of our operations that kind of create this situation where we're asking for these seats. What questions do you have? Or I'm sorry, Liz, are you going to ask what questions do they have?
Well, anybody, you can ask. So any questions for Phoenix PD? I do have one. Can I start with one, or just a comment?
Yes, of course.
What is, from MR 911's point of view on Phoenix PD, it's, if you remember, as we go through our alternate routing and disaster plans, so if there is a true disaster that are taking down PSAPs because of whatever, I always say all roads end up leading to Phoenix PD. So again, we want to keep that in mind, but that makes them, because of their size and their capability, it only makes sense that if there was an absolute disaster where multiple PSAPs were affected, things would start defaulting to Phoenix PD. And I want to have you keep that in mind as they put in for this request. So are there any PSAPs that have a question on what the Phoenix PD has presented?
This is Sean. I have a clarification question.
Go ahead.
So when you presented this request, you said it's a fallback position. Would this be funding a backup center?
No, as I said at the very beginning, it's a concurrent site. So we run 100 West Elwood 24 hours a day, 7 days a week. And our goal is to maintain that even when we move from 620 West Washington to 100 West. So currently 100 West, 100 East is running 24/7 and 620 is running 24/7. That would remain our plans of operation. So it's not going to function solely as a backup. Now, the capabilities of us having backup abilities, that is present. And that's the point that I was bringing up after that, is that when one facility has to go down for one reason or another, that creates increased capacity needs at the other facility. We're not going to be able to expand our footprint here at 100 East Elwood because of literal space limitations, but 100 West is designed with enough space. So when we fall back to just one facility for an operational emergency need, we're able to function at a greater capacity. Does that answer your question, ma'am?
I think so. So you're currently running out of both of your comm centers. They are both full?
Full as in?
You're using all, like, because my understanding was that you're either working in one or the other. I'm just trying to clarify that I'm understanding that.
Correct. Yeah, we're working out of both facilities.
Okay, thank
you. Yeah. Any other questions?
Court, just to give us perspective, tell us about your minimum and maximum seating requirements.
Minimum, I think in 911 at any one given time is 20, but we don't plan for minimums. We plan for what we should have on hand. And I'm sorry, I'll offer any other managers to correct my understanding or those numbers. And if we need to follow up, actually, let me follow up because I want to make sure we're exacting with you all in terms of our minimum and maximum staffing requirements. But again, we don't operate or plan off of just the minimum. So we plan for, what not only the need is, but the number of staff we have on hand.
So I think, and I would appreciate that, but I think that's significant to show that the minimum is 20. So you can see how big, and like Court said, the complex the operation is by having that.
And it depends on the hour. It fluctuates throughout the days. Sometimes it's higher and sometimes it's lower. And I'll tell you right now, we have overlapping shifts. And so it might be 20 per day shift, but when shift 2 comes on, then that can almost double or even increase, triple that number. So again, when we talk about complexity, it's hard to just say, hey, this is that number, because the way our operations are set up, that number fluctuates throughout the day. I get maybe the concern that's being voiced that we don't want to have empty seats all day, every day, and neither do we. So that's why we're hiring. If you know anybody good, please recommend them to come to Phoenix. That was a joke. But overall, that number fluctuates. So it's not as easy as saying it's just 20 or it's just 25, because that would be inaccurate.
Okay, anything else for Phoenix? All right, we'll move down to Scottsdale. Karen?
Good morning. Like everyone else who has spoken, our numbers are also increasing. We're going up about 4 to 5% in call volume every year and call for service. Our city, while not expanding in the same way that Goodyear is also expanding, particularly in the downtown region where they are building up and infilling rather than, since we've run out of land to occupy. The reason that we're looking for this right now is that we are beginning a remodel pretty soon. We're incorporating a real-time crime center attached to our communication center. So we need to rebuild at this point. And we do meet the qualifications for additional seating. And what we've noticed, especially with special events, because we have a lot of those and they are also growing exponentially every year, is that we are actually running out of the amount of seats that we need to have call takers at so that we can staff these events. And between that and the increase in call volume, we think this is the opportunity that we need to take to add 2 seats at this time. What we're planning on doing in the remodel is moving our training area so that it is attached to our communication center. We'll have like a storefront door so that it can actually be opened up and incorporated as part of the comm center so that it can be used for training employees, but can also be opened up and used for staffing event personnel or other large storms or times where we would actually have more employees than we have seats available.
Okay, any questions for Karen? All right, Lisa, Apache Junction is asking for 1.
Okay, I'm here. Sorry, technical difficulties. I don't have, I was just coming in as a brand new manager. I didn't have access to ECATs, which Liz is working on for me. Appreciate that, Liz. As I remember last when I was looking for our chief, our brand new chief, Chief Pooley, for our call volume, I believe we were close to 40,000 calls. We are looking for 1 more workstation for the next fiscal year 24. I'm sorry, 23-24. As we had, the city has just or actually BLM has just recently sold 10 square miles to developers. So in the next 3 years, we're looking at least 10,000 rooftops going in. We currently have, I only have 9 staff right now, but we're authorized staff for 13. I have 3 working stations, actually 4 working stations, only 3 of them have radios on them. 1 is kind of a training station. We just got approval for 5 brand new radio consoles. So we're going to be setting up another console, giving us 5 workstations. Not being into this current budget year, we will have 1 console that's going to be short a phone station. So we'll just use it as a training for radio and CAD. So at this point, for this next budget year, we are requesting 1 workstation to bring us up to 5 complete stations.
Thank you, Lisa. And
actually, there's one more thing too.
Okay, go ahead.
The logging recorder, we just recently purchased a logging recorder. So we're going to be looking for maybe to get some funds back on that for the logging recorder too. I think I sent you the invoice, and then that's about all I have.
And so Lisa, in the state, looks like they have you as 3 funded, and you're actually 4 funded currently, and you're asking for a 5th.
Yes, we are we are 4 funded right now. We're looking for a 5th.
Okay. Okay, so that needs to be changed on the spreadsheet. Okay, any questions for Apache Junction? All right, Stephanie with Chandler.
Good morning. Okay, we are requesting one position. We have 16 consoles in our center. Only 15 at this time are equipped. At one point, there were 16 equipped, but one was on loan from Entrado during our Viper 7 upgrade. So we currently have 15 that are equipped. Our call volume over the last 3 years, in 2019, we had about 350,902 calls that year. We saw an increase of about 25,000 in 2020. Then that dropped by about 10,000 in 2021. Now in 2022, we are trending about a 5% increase. And our calls per seat ratio falls above the 911 state 911 office average. So we're just requesting the one for that fiscal year. That's what I have. If you have any questions for me, we'll see if I can answer them.
Thanks, Stephanie. Does anyone have any questions for Chandler on their one additional position? Okay, and then we have Lieutenant Hadley with Wickenburg.
Good morning. Obviously, our call volume is not as substantial, but we're in the process of a move. We have 2 workstations currently in our old center. We've built a new center. It's going to have 3 working workstations there. We only have 2 positions that run 911, but our staffing level is typically 1 dispatcher at a time with an overlapping second, and that second is often our dispatch supervisor. So I'd like to get us to a point where all 3 consoles that are in our center are fully operational for the supervisor that overlaps, as well as when we increase our staffing, so we can have at least 2 on at a time. That way it'll account for breaks and calls and whatever else. And when ish hits the fan in Wickenburg, it's usually 1 or 2 people at a time. And so when we get additional resources to come in to help us out, there's not a fully functioning console to be of assistance. We currently service the police department. We dispatch for the fire department. We'll take 911 calls for medical and then have to get a hold of AMR to then dispatch an ambulance. We're in 2 different counties, and then in Yavapai County, we have a ranch called Wickenburg Ranch that's growing substantially. They have 3,000 plots for homes to be sold, and that continues to grow with the building permits that have been issued. In 2021, there was 409. Last year, yeah, that was last year, sorry. In 2022, we've already done, in the first 6 months, has already been 153 homes. And they're plotted for 3,000, like I said. Our call volume fluctuates from summer to winter because we have a lot of winter visitors. So our population pretty much doubles. It goes from 8,660 that are actually registered as in the census of living here, and then it usually jumps up to all the ropers and the cowboys and everybody up to about 12,000. So it's a lot of people in a small town. Yeah, so just trying to logistically plan for growth and getting all 3 workstations that we have planned in our new center to be fully operational for trainings, for the supervisor to have a station that she can help out and jump in when the other 2 are being filled. So that's all I have. Any questions?
Thank you, Lieutenant. Any questions for Wickenburg? Okay, thank you, all the PSAPs for participating on that. And I know that some of you are still working on some of your paperwork for that we request to forward up for the August meeting. And that will be the documentation that will be with your request that will actually go through the MAC process. approval process. So we need to have that sooner than later, but I can reach out individually to you to discuss what parts we need and what you have and if you have anything missing. But the question is, and this may be for discussion and the governance group members pipe in, do you think it would be worthwhile to take our formula that you worked on and see how the numbers fall out for the PSAP request?
From the Phoenix perspective, the collective response is no.
Okay, thank you, Phoenix.
Goodyear's opinion is yes, it would be interesting to see.
Goodyear, okay.
Yeah, I think from Scottsdale, we'd be interested.
Glendale as well.
And maybe we can crunch those numbers and then email them out to the group, just so you have a perspective. We won't wait till the August if we can get those numbers to you sooner than later.
Can I amend what we said?
Yes.
Yeah, I guess our more explained position is that we're interested in seeing what that formula looks like and what that process is like.
Yeah, because it is for Phoenix PD's managers that are just joining us can understand is there's a lot of factors into it, more complexity that we factored in size wise, that, you know, the Wickenburg requests where it sounds like that makes sense. They need a third position for the supervisor, and then they have two dispatchers that balance the radio traffic and the phone. And then Phoenix PD, where it's the largest, it needs that type of, because of the complexity and the type of call volume. So how can you fairly judge? That was one of the things the governance team really looked at. How can we fairly judge each PSAP? And they factored in training, they factored in a non-emergency, all the things that are going on there. And so it was much more complex. So I'll be curious to see how that shakes out. And we'll meet with the governance, we'll meet and see if we can't start crunching those numbers and get them out to you guys for reference sake. And we can talk about it more in August. But as I said earlier, August is when we'll be actually voting on the budget, and that a budget as a whole, including the workstations that are being put forward. So any questions at all on this agenda item and budget? Okay, Brittany, Chairman Brunet, I'll turn it back over to you.
Okay, so this item was on the agenda for information and discussion only. So we'll be moving on to the next agenda item. The next agenda is discussion on the Next Gen 911 Core Services Project. The NG 911 Core Services Working Group will lead this discussion.
Liz, is that my turn?
Yeah, and if you could advance the slide for Karen's going to go over some training. Hi, Matt. Can you advance the slide to the next for Karen's training? There we go. There you go, Karen.
Thank you. So there's a group of you that have already been in a lot of conversations about this, but this fall, MAG region will be going to NG 911, which is going to mean that we have to have some decisions ready as PSAPs, mostly for advanced planning. I put together this training that I sent to Liz, and she can make it available to anybody that does not have it yet, as well as a document that kind of walks through what the responsibilities are for each manager and the dispatchers in an area affected. If we can just scroll through this, go to the next slide, and basically what we're talking about is NG 911 technology gives us alternate choices as far as routing. For many years now, we've been limited to a backup center where we would flip a switch, call MR 911, and they would route calls to generally one PSAP. With NG 911, there are unlimited possibilities for us. So depending on what the situation is, taking into account when Mesa was talking about the additional workstations that they were requesting as they're covering for Florence PD, there are PSAPs around the country that close at 5 o'clock in the evening and direct their calls to another agency. Something like that would be possible and could be scheduled out in advance. If we run into trouble with staffing, if we have a large scale incident where we can no longer take all of the calls ourselves. So as we walk through this training, and go ahead and go to the next slide, please. This next screen is information that Liz put out that, again, we'll make this available to all of you so you can look at it in depth, but it shows each one of the PSAPs in Maricopa region and what their first choice is for where they're already sending their calls in an emergency situation. And then if they chose that same one as their first choice, and then the possibility of choosing a second agency as a choice, either if the first one was unavailable or to share the calls between the first agency, the second agency, and possibly even themselves. Chandler, Tempe, and Scottsdale tested this on a smaller level earlier this year to see what would happen if we all put our calls into the same bucket. And we found that it is workable operationally. There are some things that each manager has to do. Go ahead and advance to the next slide. Including determining if you're still going to be able to take calls in your own center, what the result to the person calling is there an automatic transfer? We could choose a fast busy. I don't think anybody in this region is going to want a fast busy for anybody calling 911. Next slide, please. So I'm not going to go through every one of these. I'll probably have us just go through very quickly so that this is something you can look at in your centers later. But what I did is I rolled through some rules that we need to make decisions on. So if there was an error in your phone system, how could we handle that? And how can we plan in advance? So if that happens, you may not be aware that it happens, but MR 911 is aware and can put into place whatever your plan is. So each one of these, if you can just advance the rest of the slides just quickly enough that they can see them. So planned evacuation, PSAP failure. Go ahead. Large scale incident. And then I start getting into things that are involving more than one PSAP, right? So if we had a large scale incident on the east side of the valley or on the west side of the valley where you could not send to your neighbor, and you might need to choose agencies that are across the valley. And then even if we had something that affected all of us in the region, is there an option that we can put into place in case we needed to send outside of the region? And as Liz has described before, this even includes plans for sending calls out of state and possibly receiving calls from another state. So there's a lot of work that has to be done just to plan this. And this is probably something that each one of us needs to at least get a grasp of, because if you're in that situation is not the time that we want to start making that decision. And there's some checklists that are involved for a policy for each department, including making sure that the other agency is capable of helping you out if you need the help, having options available in case that's not going to be an option. Liz has already started putting together this list for the state, and so that MR 911 can be ready. But I think, and Liz, correct me if I'm wrong, I think a lot of this was done with limited manager input at this point, and we really need a lot more of that.
Meaning on who their alternative routing sites were?
Yeah, that we didn't really get a lot of in-depth information from the different PSAPs, right? As far as them making alternate choices other than what you already just had in place.
Well, we did add second. Not everybody took a second PSAP, but some of them, and I have to give a shout out to the West Side because they were organized, and the PSAPs, you can tell they sat down at a meeting and went over what does this look like. So this is going to be a continuing evolving as we get to know the system better. And so the thoughts were, and we can absolutely discuss it and change it, is that we would get our baseline of 1 and 2 in place, get the code over done in September and October, but we can absolutely add complexity and things that we feel like we need to do as we go along. That is not a problem at all. And then the idea is once in October 2023, when the whole state is cut over to NG 911, then we start looking at what it is that we can do for going outside of the counties. And then after I've retired, then we can look at what you do after you go out of the state. But actually, no, we can, because of the border ones, it actually might do them well, Yuma and up on the northern border. I know that there's struggles there. So it's just evolving as we learn. But I reached out to and had a visit with Pima County to ask how complex they are. And they were the same mindset. They weren't going to get real complex until they understood it better. So that made me feel better. Maybe some other areas of the state are doing a more complex. We'll let the state read to that. But the urban areas are trying to keep it manageable until the cutover, and then start adding in and planning it so that it doesn't cause any problems to have too much complexity during the cutover. But once again, the PSAPs, if you guys want to add complexity before then or add more options, we can absolutely do that. And plus we have the ability to, between us and Comtech, to be able to do stuff on the fly if the occasion happens. So does that help answer your question, Karen?
Yeah, absolutely. So I think that what this will be is probably a long-standing work in progress, but something that we are definitely going to want to be familiar with, especially as we're listening to a lot of these remodels, and we know that all roads eventually will lead to Phoenix. That probably needs to be in some sort of a, maybe even we should create some sort of a workflow, and at what point things do end up in Phoenix with all of us, in there with them.
I agree, Karen, that the governance will need to be there to show in an emergency what that looks like. I believe in Texas during Hurricane Harvey, they all pointed to Greater Harris County because of that. It absolutely took out all the PSAPs. And so can we keep 911 going when PSAPs are affected? How can we keep that going in the region, and how can we keep it going in the state?
Yep. So that is all that I have for right now. Liz, would you be able to, let me just make sure all the documents get to the PSAP managers then?
Yeah, I'll forward those out, the PowerPoint that Karen went over along with a documentation, so you can start preparing your individual PSAPs of the upgrade and get their input on it.
Okay, thank you.
Okay, so Brittany, it's back to you.
Are there any further questions from the membership on this topic? Okay, so this item was on the agenda for information and discussion only. We'll go ahead and move to the next agenda item. This will be the Arizona 911 Office Report. A representative from the state office will report on statewide 911 activity.
Good afternoon, everybody. I think one of the first items that we wanted to discuss was the call ratio spreadsheet that was sent out. I know there was a little discussion on it previously on an earlier section, but I just wanted to elaborate a little further on it. So we kind of discussed last time about the old processes and how we wanted to get something at least put on paper quickly so that we could use data to support making the decisions for additional seats. And so this is kind of the first iteration of what that looks like. We know that there's definitely opportunity to make it more robust than it is present day. One of the asks that I have, and maybe it would be through this governance committee, is just any kind of communication on ways that we can make improvements. There have been several PSAP managers, some within Maricopa County, who have offered up some ideas. I think that's something that we just want to make sure that we focus on is it needs to be something that works for the entire state for all 81 PSAPs and nothing that is defined to a specific region. We want to make sure that all counties are operating under the same precedents in terms of how we would approve or deny additional seats. So if you have any ideas, please get creative. Let us know on ways that we can make improvements. We're very open to making it better. And I think that is the only topic regarding the call seat ratio that I wanted to discuss.
Travis, real
Yes,
quick,
ma'am.
just clarification on one of the columns. You have total 911 calls, total funded consoles, and then you have total unfounded consoles. Is that a typo, or are you categorizing
Yeah,
unfounded?
it's just a typo. It should be unfunded, and we'll make sure that we get that AJ seat moved over into the category for them.
Okay, thank you.
The second item that we wanted to talk about was some aspects around the budget and a budget amendment that was submitted by MR 911. The first thing just related to the budget in general. In speaking with a lot of the PSAP managers, both within and without Maricopa County, it sounds like in the past there was a lot of discussion about being hesitant to make any submissions regarding the need for any kind of technological advancements that would have a high cost for it. And I would really like to kind of reset the expectation because we definitely feel the exact opposite. So when you guys are submitting your budgets for fiscal year 2024, we really want you to ask for anything and everything that you need to be successful that you believe is something that we should fund. Whether it's, even something we should consider or not, please add it to your budget submission. We are getting very advanced with having these conversations regarding additional funding, and we need as much data to support it and justification that we do need that additional money. So I'm not saying that we're going to approve everything that you're asking for, but the more that we have to deny, I think is more justification that we do need additional funding, and it would help and benefit the PSAPs. So if you could please add as much as you can to your budget request submissions here for FY 2024, I think we could really use that data to make a strong argument that Maricopa County specifically does need a significant amount of additional funding to be successful in the future. And then regarding the budget amendment, Liz submitted a budget amendment request for the FY 23 budget. We're still waiting on a little bit of additional documentation, but that's something that we're going to be working on and making an adjustment to. It's about an additional $1 million to the Maricopa region. So once we have any information on that, we'll make sure to go ahead and share it with the group. Third thing that I wanted to address was we have some additional information regarding the conversation that was had last time around data analytics. We looked at our contract with Rapid Deploy and wanted to advise everybody that the contract ends April of 2023. So we've only got about 10 months left on that contract. Our goal here is to more than likely open an RFP for a statewide data analytics solution and allow whatever vendors have a product to come forward and be a part of that solicitation. So just to give some examples, Rapid Deploy would more than likely submit. Rapid SOS is in the process of creating a data analytics platform as well. We met with them earlier this week, and it should be ready by the end of this calendar year or possibly Q1 2023. So that's something that we would be interested in looking at. The majority of the state is moving towards the Vesta platform, and Vesta offers a Vesta Analytics that would offer that same kind of statewide insight into the data. And then there are some users on this call who are using ECATS and other MIS platforms. So our goal is to have this really kind of be driven through the advisory board or anybody else that would like to participate in the RFP Once we get more information on that, we'll definitely communicate that to anybody and everybody that would like to be a part of that process.
Travis, are ECATS and Vesta Analytics part of the current state contract for CPE equipment?
So no, the PSAPs that are cutting outside of Maricopa County, those are not options on the Vesta platform. They're options, but the PSAP would have to procure them at their own expense if it's something that they want. Some of them have looked into doing that, but no final decisions have been made.
So ECATS and Vesta Analytics is not offered as part of the CPE option. Those PSAPs are, if they want those, they're paying for them themselves, or they're going with rapid deploy Eclipse.
Correct. All the PSAPs that we've completed in phase 1 and phase 2 are not getting Vesta Analytics or ECATS. And if they want them, they're procuring them on their own, but that even hasn't taken place yet.
But those are on the state contract.
They're options on the Vesta contract.
And Viper as well.
Yes, but we're not bringing forward Viper. So I haven't looked at that contract in quite some time, but I would assume that they are options on that contract as well.
Yeah, I would think all of them, that are on the list for CPE all have an MIS platform. I think that's something we took a look at.
I think it's just a matter of whether it's the one that they built out themselves that they're trying to make the PSAPs procure, if they're using a third party like ECATS.
Right, but you're saying that the state will only fund at this point rapid deploy Eclipse.
Correct. And then once this contract expires, we'll look towards either staying with rapid deploy or moving towards a different statewide solution. And it was a little bit of what we discussed last time. It's a waste of money to just fund multiple different products that do the exact same thing. So it's just a cost savings initiative that we're trying to drive. So I think that's all that I had. I am going to kick it over to Greg, who's going to give an NG911 deployment update.
Thank you, Travis. Good morning, everyone. I'll try to get through this pretty quick. Our phase 1 migration, I'm going to break it into 2 sections. NAUA, which is Navajo and Apache counties, they are on schedule for July 22nd start migration and concluding on the 29th of June. I said June 22nd to June 29th. And that's with Solacom Comtech. We are expecting probably a delay on White Mountain Apache Tribal PD due to some frontier circuit builds required for the last mile that we're seeing a delay from Frontier. So that one piece that may get pushed off a week or 2. The other part of phase 1 is La Paz County and Mojave counties, 6 PSAPs in total. They are going to be pushed back a few days, over a month, and now we'll start July 18th and conclude July 29th. And this is a result of a delay of third-party last mile circuit provider delays and supply chain delays with the compressed schedule that's on our call handling as a service side. This change will not impact MR911's migration efforts as well. And phase 2, we are looking at, excuse me, right now, to see if this phase 1 is going to impact that. Right now, we don't have a change in that, but we are evaluating whether that's going to be pushed back at all. And we'll have more information on that to come this next week. MR911, the next gen core services migration for your area. We passed a schedule over to Liz, and Liz approved it. And that was kind of just a quick placeholder as I look at it, from September 22nd to November 9th. There's a meeting scheduled next week with a few people to fine tune that schedule with Comtech and true it up to the needs of Maricopa. After that, we'll changes accordingly. Phase 3 migration, that's Pima, Cochise, Graham, and Greenlee counties. It's in progress. All vendors, or I'm sorry, all PSAPs have selected a CHE in its Vesta, and that completes the step 3 of the 7-step process. So they're on their way. They're scheduled for cutover migrations between February and July of 2023. And phase 4 hasn't started yet. It will begin in late July with the initial first step of the process for vendor demonstrations for call handling equipment. And again, they're scheduled as it stands right now to begin September, their migration September, and conclude in October of 2023. That's all I have unless there's any questions.
Okay, thanks, Greg. I think we'll kick it over to Eric for some GIS updates.
Thanks, Travis. I will move through this really quickly. Good morning, everyone. Eric Shreve. Just a couple updates related to GIS as we transition to next gen. Working with Dave and the MR911 team, they've taken some pretty significant strides as of late of incorporating the required NINA GIS fields as it relates to the NINA data model. So appreciate that, Dave. The other one is that I know between Dave and Angela, they're still actively researching the ALI MSAG discrepancies, seeing what that comparison looks like with GIS, given we have some time still before that cutover occurs, going through that process and evaluating what the outliers look like. And then related to the strides of improvement on GIS data, Phoenix Fire and the coordination that they've had with MR911 and with the state, they've been able to incorporate NINA specific fields to meet the requirements that we're looking for to meet to ensure that calls are spatially routed. And then with all this being said, the plan is once the GIS data meets a level of conformance that we're looking for, which is at 98th percentile, the GIS data will then be loaded to the statewide repository through a change detection process. And then at that point, it gets provisioned into the ECRF and LVF once we start the transition to cutover. And then just one little snippet that I would add, we are in a collaborative partnership with Amazon right now. And what they're looking at is helping us cross-reference address point data that the state has. We have a couple counties that we're looking at for a pilot as far as having the opportunity to improve our address point data. And what that would do is provide us address points in XY format. That's the only data that we would provide. And then we would reverse geocode that off our road centerline data that we have leveraged at to incorporate that into the overall statewide repository. So lots going on with GIS. And if there's any questions, feel free to bring them up and I will kick it over to Jill for the 988 discussion.
Before we kick it over, I have a question on, and maybe I've asked this from the state before, and either Eric or Greg, you might need to answer this. At what point does Comtech own the MSAG? When does that shift?
So we haven't had that discussion yet, specifically with MR911. The location database manager process is getting implemented right now. Obviously that's a transition that occurs with the telco and Comtech, how they coordinate that agreement with both Lumen and Frontier, but I don't have a timeline on when that will officially happen.
So when we're doing true ups, our normal true ups, and we get a MSAG dump to do a comparison, we'll just keep going through Lumen until you tell us?
No, so once that transition occurs, all this process will be done through the location database manager, and that is coordinated through DDTI as the sub vendor of Comtech. That comparison and doing the synchronization of the GIS data will be done through that process. So nothing will be done through 911net and Intrado's tool that they use with Lumen.
Okay, and so as we're planning budget, that's a cost to us to get those dumps. So should we go ahead and continue planning on that just through fiscal year 2023 until the state's all cut over? Do we anticipate that we won't have to make those the payments for?
I would anticipate you don't have to make that payment.
The way that I understand it, Liz, and we can confirm this with Stephen, is that once all the PSAPs are migrated over in Maricopa, which should be that November timeframe, that would go away and you would no longer need to pay that. So we can make a confirmation, but that is our understanding of it.
Okay, good to know. Thanks. That's good information.
Good morning, everybody. Just a couple things I wanted to bring up today. 988. I serve on one of the committees for the state with 988. Karen Sutherland is also on that committee. We also formed a task force for 988 to get some things moving along with this. We will have some workflow sheets for 988 for your call processes up on our website probably tomorrow. I'll send out an email to each of you once that's available. There will also be some training information on there, FAQ information, so that 988 information will be on the website. In addition, if you have a need to edit those workflow sheets to your specific agencies, as well as policy and procedure stuff, just let me know and I can send over editable copies to each of you. So that will be probably done, I would think, tomorrow afternoon, but I'll let you know when that's up. In addition, service plans, all the service plans for the state were required to be submitted by the end of May, which was May 31st. To date, I have received 0 from the Maricopa region. So because of that, those requests now, and this is information that we need for a lot of the projects that we're working on. So I will be sending those out now to the comm managers to complete, and those will be needed to be done by the end of the month.
So Gerald?
Yes.
Just a clarification, and I'm sorry this didn't get communicated to you. We're waiting because the state provided it, the format in Google Docs. The city of Phoenix is giving approval. They don't use Google document at all.
That's fine, Liz. I've offered to do a manual document to provide out.
So
and I've done that to several people across the state, but these documents need to be turned in.
Okay, so if you can send that to me in the correct, in a different format than Google Docs, then we can get them complete. We do the service plans for information's sake for the PSAPs. It's something that our office submits and they're due every December, and we put it in as part of the grant process, our service plan, any changes to it. So now the state has changed what the information they're seeking on the service plans, more statistical. So we just
A lot of that information is specific to those agencies. So are you going to reach out to each agency then to get that, is my first question. And how soon can I expect to have you submitting those to me by?
Send them to me and we'll start working them on this week. How about next Tuesday?
Okay. Thank you. That's all I had. Thank you.
So Gerald, let me ask you a quick question. I've been contacted by a couple of PSAP managers that the state is scheduling meetings one-on-one with them. They asked me what it was referenced to. I told them I had no idea. So can you brief all of us on what it is the state's wanting to, as they do these site visits, what it is you're looking to review, or what kind of a meeting those are set up for, and then they can all know.
Yeah, absolutely. And I have reached out to almost all the comm managers in the entire region as well as the state. We are going out to agencies, visiting with comm managers, just making ourselves available and letting them know some of the resources that we offer as a state.
And I can elaborate on that as well. I think there's just a lack of understanding in kind of what next gen is and the transition and maybe some of the lift that might need to come from the PSAPs, as well as just kind of getting out there, like Gerald had said, and showing our faces and letting them know we're available if they have any questions. There's a lot of things that are just going on in general, as Gerald had mentioned, kind of this uptick with 988. It's not something that we had initially wanted to get involved with, but the access group reached out to us, and I think it's pretty obvious that they need some assistance with that. So we're trying to help in any way that we can. So our roles, as has previously been discussed, is kind of transitioning a little bit because it just seems like it's kind of being forced into this new role that we're trying to create. So, but if there's any additional questions related to that, you're more than freely welcome to ask.
And as always, we keep you as an agenda item on our PSAP meetings so that you can brief us as a whole on anything, and that saves you if I'm having to go out to all the PSAPs. But thank you for answering that.
We will also be sending out a document here, hopefully next week. It's a formal document that kind of explains in detail really what next generation 911 is. So if there's any confusion or anything that's being lost in translation, I think this will be a very nice document for you to have and for you to take to your stakeholders at your PSAPs to kind of explain to them a little more in detail as to what this transition entails.
Okay, so do we need to incorporate that with our training, Karen Sutherland?
I'll certainly take a look at it and see if I need to make any updates.
Okay, you can just send a copy to Karen as well, and then NG 911 committee can incorporate it into the training.
Okay, will do. Thank you.
Okay, Brittany, I think that was in for the state.
Okay. Any further questions from the membership? Okay, so this item is on the agenda for information and discussion only. We'll move on to the next agenda item, which is the report from the Maricopa Region 911 on technical updates and the 911 system upgrade projects. Mike Benjamin and his technical team will provide us with this report.
Good morning. Thank you. Try to whip through this here pretty quick. As reported in the last meeting, Fort McDowell had upgraded to a Viper system in March. So there was some work continuing with primarily with Lumen to get some of their stuff straightened out. We still continue to work with them on some of the legacy concerns integrating with that Viper system. Fresh off the press just from yesterday, Scottsdale went to a new Vesta system. So Nate and our group busy working with them, working on final integration items and so forth. Most of those integration concerns, as reported so far, have been on non-911 telephony type things, but that is certainly obviously a work in progress. Tempe, middle of August, is scheduled for a cut to a new Vesta system. So thankfully equipment, no supply chain type issues, equipment is in our possession. Most of that actually has been installed up to the point that we can get to at this part of the project, but we don't see an issue at this point being able to move forward with getting Tempe cut to their new Vesta system in August. Been working with the town of Wickenburg, working on the coordination to get them into their new building. That'll be later here in 2022. The unfortunate aspect there is that it did not coincide with new call handling equipment. They won't be getting new call handling equipment until fiscal year 2024. So this produces a challenge of having to try to support them in both locations. So we're working with them on the details there. AMR, Rural Metro, they have opted to move to a new facility that will coincide with new call handling equipment. They are looking at this point at calendar quarter 1 or possibly calendar quarter 2 of 2023. And they will be going with the Comtech Solacom Guardian product. Phoenix PD, is weaved in and out of this conversation here today during this meeting. They are looking at a new building, 100 West Washington. That will be new call handling equipment. No date determined specifically on when that cut will be. Lots of moving parts and pieces. And then Luke, new call handling equipment, refreshing their existing Vesta install, and a date to be determined. Greg from the state office mentioned some work on the next gen core services stuff that should be in the fall here. So we're working with Comtech. We continue to work on the design and engineering associated with our part of that project. A lot of work has been done in the data and networking area. Associated equipment has arrived in the data and networking, and we've been integrating circuits from the various providers. There'll be multiple levels of redundancy for those circuits, and that circuit work is actually just about complete, which is good news, because as Greg mentioned, getting circuits can sometimes be a laborious part of a project, and timelines can become difficult to manage. We do have a significant amount of additional equipment that is expected from the ComTech resources. Integration and testing into the PSAPs will have to wait until that equipment arrives and allows us to install it, get it racked, stacked, networked, and so forth. So we are obviously in the beginning of June. We believe that we have enough time to do that. We're anxious to work and move forward with these integrations because we do have various product with Viper 5.1, Viper 7, and a couple versions of Vesta now in the environment. So as soon as that gear arrives and gets stood up to a point where we'd be able to begin integrating with the PSAPs, we will be working in a very rigorous manner to test with PSAPs to make sure that this type of NG911 trunking is working, and you'll start to see some of that. And obviously that will occur well before September, if September continues to be the cut time. So I blew through a lot of that. I'm open to questions. If there won't be any questions, or if there is not any questions, I will have that be the end of this presentation.
Okay, thank you for that report. This item is on the agenda for information and discussion only, and we'll go ahead and move to agenda item number 9. Are there any requests by the membership for an item on a future agenda? Okay, no request. Are there any announcements from the membership for agenda item number 10? Jim has his hand up. Go ahead, Jim.
I'm sorry, you said item 10. That's like the just open announcements, correct?
Yep.
Okay. I just, I've been asked by my bureau chief to ask the group in general. We had a demonstration and some discussions with a company called the Vitals app. And I just wanted to see if anybody's familiar with it or looked into it. During our agency's discussions with that company, they had brought up the possibility of, instead of doing a single agency implementation, possibly doing a county-wide implementation. And so I wanted to see if anybody had any feedback or any information they wanted to provide.
Jim, it's Karen from Scottsdale. We've done some research into Vitals, as well as bringing our crisis teams also into that. And for anybody that's unfamiliar with it, Vitals, there's, I guess, a couple of different subscription models, but if a department purchases a subscription, then anytime that someone with a mental health concern, or I guess that's really what it's mostly geared toward. If an officer has the app on their cell phone and someone has put information into this, like I have an autistic 6-year-old, et cetera, when they get within a certain feet from that individual, it sends an alert to the officer's phone so that they know that they're in the presence of somebody that's put information into this Vitals app. But even if the agency chooses not to subscribe to that, individuals that enter their mental health information or somebody in their family into the Vitals app, that will load into Rapid SOS and be delivered with Rapid SOS information into the PSAP anyway, which is why we brought our crisis folks in as something to start talking to some of the families that they work with.
Thank you, Karen. I appreciate you adding that info. Yeah, like Karen said, I think it could be a big benefit. My only concern is that If you want the field side of it, there's a subscription that the agency has to pay, and there's also a subscription that the community member has to pay to build a profile. Now, those are both negotiable rates, and they had mentioned that part of the contract with the agencies could be that they supply so many numbers of free profiles to community members. So that's something we could look into, or we're going to be looking into as well. But I see the benefit on both sides. I see the benefit in dispatch, and I see the benefit for the folks out in the field. And like Karen said, is that it's the autistic or the mental health issues, or if they just have general medical problems, or just want to load general emergency contact information. It seems like there's a lot of potential for it, and so I wasn't sure if anybody else had looked into it as well.
Karen, have you seen it pop into Rapid SOS and seen what it looks like, or is it not pushing through Rapid SOS yet?
We have to have somebody that makes a phone call that has put into it. So I've really only seen it from a demo perspective at this point.
Okay.
I can say that I looked at like the cost to a family, and I think it's as low as like $2.99 a month if they needed to put, say their father has Alzheimer's and he's a wanderer or something like that. Like, I can see a lot of value that would be to families that use this product, whether or not the agencies get the alerts. Just to have it through Rapid SOS would probably be pretty advantageous.
So would the family have to call 911, or how would that come across, Karen? Do you know?
Yeah, basically what they would do is register phones, and if a call is made from that phone, so something's happening in that house and we're responding based on that phone, then we would get the information that they put in. That's where the benefit of having the alert for the departments come in, where even without a call from that phone, if an officer got within, and I can't remember if it's 30 yards or something like that of the person, that they get an alert.
Okay, thanks.
Hey, good morning, everybody. It's Nicole with Phoenix Fire. This kind of adds to our discussion that we're doing on mental health, and I don't know how many people are aware of this other than Phoenix PD, on something that we're standing up within the fire department, and it's going to be a new behavioral health unit that we're going to be rolling out here in the near future. So all of these tools that you guys are talking about with the 998 coming online, along with this other tool that has through Rapid SOS, is all something that we're going to be very interested in as we move forward. So very good discussion, and I'll keep you guys all apprised on how our behavioral health unit is going to end up playing out. But we're going to start the pilot process here very quickly. It's coming fast and furious, along with telemed or telehealth. So just thought I'd throw that out there to add to the conversation. It sounds like mental health is going to start being incorporated more into the 911 centers. So that's all I have.
So Nicole, is that unit going to be for all the agencies that Phoenix Fire answers for, or is it going to be for Maricopa County, or what is it going to be?
Right now it's Phoenix only.
City of Phoenix only, or all your CAD partners?
Oh, City of Phoenix only.
Okay.
I think that the region will probably have their eye on the telehealth component of it, but right now we're just rolling it out for the city of Phoenix. So.
Okay. Okay, Brittany?
Okay. Liz, did we make a decision on the next date? We're keeping it the 18th or were we moving it to the 4th?
For the group's benefit, APCO is on the week of our normal meeting, so we were looking at moving it before or after, and there's discussion, we said the 18th, but there's discussion to actually move it to August 4th. So that's what we're going to lean towards unless there's an issue with scheduling it with MAG. We'll make it August 4th, and I'll reach out to all the participants and stakeholders to let them know, hopefully by the end of this week, whether we are going to have the 4th or the 18th.
Okay. Well, the meeting is now adjourned. The next meeting of the MAG PSAT Managers Group is currently scheduled for August 18th, 2022, and Liz will follow up with the group later this week with a confirmed date. Thank you and have a great day.
Thank you, everybody.
Thank you.
Thank you.